Now they can see more with CAT scans and things like that, and they can get a pretty good idea of what's going on. Some of the things that they'll do is a complete physical exam. Okay. A complete physical exam for their overall health. They'll look at mental ability tests that check their memory, their problem solving, attention span, ability to count, and the use of language. One of the biggest things that they can do, they'll give them a math test, just a very simple math test. Most Alzheimer's patients can't do it. Or if they're developing Alzheimer's, they're not able to do it.
Take care of that.
Okay. Routine lab tests are done, such as blood, urine, spinal fluid, to rule out any underlying causes, and CTs and MRIs. Okay. So is it Alzheimer's or is it just old age? Anybody know what the difference is? Just old age is just a normal progression of being slightly forgetful. You might have to write you a list or have one spot where you hang your keys all the time. And that affects all of us. But the top 10 warning signs for Alzheimer's are forgetting how to perform just daily routine tasks, like getting up and driving to work. Okay? Forgetting how to perform simple tasks like driving home from work. Okay? Having trouble with language, being disoriented to time and place, showing poor judgment, like leaving the stove on, having problems with thinking. They clearly, you can tell that they just can't organize their thoughts. They misplace things frequently. They have frequent changes in their moods and behaviors. Somebody who's really stable and they're usually a really calm person, they're usually a dead giveaway that something's going on because they start having mood fluctuations. Okay? They start showing drastic changes in their personality. And they start losing motivation for living a normal life. Okay? And there are some drugs that the FDA has approved. Aricept, Exelon, and Razidine for mild to moderate AD. Okay? Aricept or Namenda for moderate to severe. Now there's a big thing going on about Namenda these days that Namenda doesn't do anything. Having worked with many Alzheimer's patients, I would tend to agree with that. Okay? And then they're also trying to go more with antidepressant medications to regulate mood and sleep, things like that. Because if you don't get enough sleep, what happens to you? You're really okay. You can help a patient on Alzheimer's medication by recognizing and reporting any side effects that you see. What are some of the side effects that you might see with those meds?
With the antidepressants?
They might be a little lethargic, but usually it's things like diarrhea, dizziness, loss of appetite, muscle cramps, trouble sleeping, weight loss, constipation, headaches, drowsiness, things like that would probably be some of the things that you're going to see. Okay, so what would you consider to be an early stage of Alzheimer's? It's the onset period, so you're going to have poor concentration and a shorter attention span. You're going to have trouble making decisions, short-term memory problems, things that are happening right now in the last few days, things like that. They're going to have more trouble remembering than things further back. Okay? Forgetfulness, like forgetting names and dates, things like that, depression, and some personality changes, but you won't see that as much in the early stages as you will later on. Okay? And in the very early changes, they have a change in their sense of smell. Okay. Okay, so then we get into the middle stages, which this is more progressive and can last up to about 12 years. So as you see, with Alzheimer's disease, it can take many, many, many years before anything happens. Now, some people will go through 1 and 2 real quick, and then the third stage lasts real long. Some people will be in the first stage very long and then bounce right through the other 2. It's hard to say, it's more of an individual thing, okay? So some of the symptoms of a middle stage are episodes of getting lost, and how the wife may say, oh, he went to the store and it took him forever to find his way home. Well, that's because they're getting into that middle stage where they don't need to be going to places anymore by themselves, okay? They start having problems with speech, not being able to remember words or parts of conversations, things like that. They have a tendency to just kind of follow you around. It's like having a shadow. Follows you around everywhere you go. They also have behavior problems, such as urinating in places where they normally wouldn't, cussing or acting real silly. They have problems following directions, and they start with that shuffle and walk. Does everybody recognize the shuffle? Howell shuffle? Okay, then we get into the late stages or the terminal phase. Symptoms for this stage include weight loss, loss of balance or the ability to walk, short-term and long-term memory problems, loss of speech, the inability to perform basic skills. They forget how to go to the bathroom. It's almost like you're trying to train your toddler all over again. They have trouble with speech. They can't speak, or they can't remember how to say a word. They can't verbalize as well. And then they forget how to recognize family, friends, and a lot of times they won't even recognize themselves. Okay? And then they start developing things like respiratory infections. So how do we keep our patients safe? Okay? It's important to have the safety features in the bathrooms, like the raised toilet seat, grab bars, that type of thing. And if you can afford it, a walk-in shower. If you can't, well, you have to make do with what you've got. Okay? You encourage your Alzheimer's clients to use things like eyeglasses that have been prescribed for them. You want to make sure that there's no clutter and that it's lit. So like at night, you want to make sure there's like a night light on, things like that. You want to post pictures or signs as clues to find their way around. And you guys know, like, we'll put a name on the side of the door.
Why did they start developing respiratory infections?
It's hard to say, I don't really remember.
They tend to start laying around a lot more.
They do.
They're not as motivated.
They're not as mobile as they were before and things like that. And so they'll start...
Alzheimer's dementia affects every part of the body. Neuro, respiratory. So neurologically, your brain's telling you to eat. Your brain sends you messages that says you want to eat, that you want to breathe, that you want to go to the bathroom, that you want whatever you want to do. It's coming from up here. So when Alzheimer's is taking over the brain, because all this plaque is building up in the brain and it's just taking over, then you lose all of those signals from the brain. So then you can't to cough, to breathe. You might aspirate when you swallow because the brain's not telling you your swallow reflex is not working right now. So it's neurological.
Yeah. Another thing that they'll start doing is they'll start wandering. So then you have to really look into the security locks and things like that. A friend of ours that my husband and I looked after for a long time, he would get outside in the middle of the night and get up on the roof of the house. And it was like, how did he get up there? And he wouldn't do anything for his wife or his sons. So they would have to call my husband and he would have to come over and get him off the roof. He would walk down the road. He would just take off and start walking. And he wouldn't get in a car with anybody he knew except my husband. So in the middle of the night, he's up traveling down the road. It got to the point where we did have to put him in a facility because he was not safe. Okay? So other things we can do is keep the environment calm and peaceful. We want to avoid sudden temperature changes. We want to help with mouth care. A lot of times, one of the things that leads to like respiratory infections is they don't know how to take care of things anymore, like you brush your teeth every day. Well, they forget those things. The mouth is the gateway to the body. So if you're not taking care of your mouth, it's coming right in. It has free reign. So if we don't take care of that, then we're inhaling all of those germs and everything constantly, sets you up for things like pneumonia. Okay? You want to prevent complications of immobility, bed sores, that type of thing. Their skin becomes very fragile, so you have to really kind of keep a close eye on their skin. And break things down into small steps. Like you might say to someone else, go over to the bed and pick up those clothes and put them on. Well, you pretty much have to hand them a sock and say, sit down, now put this sock on. And eventually you're going to have to help them get the sock on because they're going to forget how to even do that part of it. Okay? Because eventually they'll become total care. Okay? Make sure that they get to the bathroom on a regular basis. Encourage regular exercise. And you may have to do range of motion exercises on them because they forget how to move. And you need to keep up a routine for them so that they kind of have a semblance of what's going to happen. And then for nutrition, first of all, you need to be patient. Okay? You need to give them gentle reminders that they need to chew or even take a drink, how to take a drink. You want to serve beverages at room temperature. It's easier for them to swallow. When they grab the cup, it doesn't feel real cold or real hot, so they're less likely to shy away from taking a sip out of it. So you got to keep them hydrated. Then you've got to eliminate anything that might choke them. Okay? Give them finger foods. So, and you got to know what to do if a person chokes. Y'all know how to do the Heimlich, right? Yeah? Okay. And make sure that your patient is getting enough to eat. Some of them will bird pick, others are just ravenous. So you've got to be able to give them a balance in between there somewhere. Okay? Sometimes you have to serve one food at a time, and don't argue with them. It's pointless. It can make them hostile. Okay, for emotional needs, encourage, but don't push them to do things, okay? Listen to what they're saying. Sometimes it sounds like gibberish, but if you understand the gibberish enough, then you know what they want. It's like listening to your toddler when they're learning to talk. Sometimes you can figure out what it is they're trying to tell you. Well, it's the same thing with a dementia patient, okay? Understand that they do repetitive behaviors. You want to keep their areas clean and clutter-free. Use night lights, limit choices. You may have to give them, do you want this or this? You know, you can't give them, well, let's do this, this, and this. Which one would you like to do? You have to break it way down, okay? And remember that it's not personal. Don't take the things that they say or do to you personally, okay? Try to stay calm and positive. Deneen. Be respectful. And watch for signs of depression. Because believe it or not, they do get depressed. Okay. What about when you're communicating with Alzheimer's patients? Okay. Always approach your Alzheimer's patient from the front. Don't walk behind them and touch them or anything like that. You'll scare them half to death. Okay? Keep your voice low and unhurried. No matter how much they escalate, you have to stay very calm. Okay? Make sure you identify yourself. Tell them who you are. You know, you can, if it's your parent, you can say, Mom, this is Candy, remember? Describe everything to them. sometimes that's a trick. Use nonverbal communication. Never scold or criticize. Remember, they're still adults. Okay? Remain respectful. Praise your Alzheimer's clients, and put on a happy face. Sometimes we need to remember that more than anything else, because we have a tendency to want to get into being very frustrated. You're not going fast enough. I've got work to do. I need to get this done. Well, no, you don't. We're working on their time, not our time. Okay? So, some of the things that when a patient gets aggressive, what are some of the things that you can do to de-escalate them?
Walk away.
Walk away. Use a calm voice, right? Stay at least arm's length away. That way you don't get slugged. Do not use physical contact to control the behavior, okay? They may need to just verbalize what's going on and get it out. Even if it's like babbling, they may need to get it out, okay? And you want to try to keep the environment itself as calm and unhurried as possible. Some Alzheimer's patients have certain times of the day where they tend to get aggressive. You might need to look to see what's going on before that happens, so that you can redirect them or distract them with some other kind of activity. Okay? Okay, and like I said, try to identify factors that will provoke the aggression. When it comes to personal care, such as bathing or dressing, provide care from the side, not directly in front of the person. It's just a visual-spatial type thing, okay? And avoid a position that's potentially dangerous when the resident is present. Put the resident between yourself and a wall when walking. Okay? If they're in that stage of aggression. Some patients never get in it, but that's true for any type of aggression. Okay? And sometimes you have to put them in timeout. Just put them in a room where it's quiet and let them be. Okay? Okay, other things you want to remember are to maintain routines. Okay? There needs to be some kind of structure in their day. Maintain a familiar environment. We all know that when we get residents and they have dementia, what's going to happen the first 2 weeks that they're here?
They're very disoriented.
They're very disoriented, they're very difficult to deal with, but if you give them time and work with them a little bit, they'll calm down because they don't know where they're at. So try to think of that as, you know, how would I be if I'm in an unfamiliar setting and I don't know anybody and the language sounds kind of weird, you know, how would you feel? Because that's where they're at in that stage, okay? Routines are necessary to keep the stress levels down and to prevent unpredictable behaviors, okay? Activities can help. When we first took over Arbor Village, in their Alzheimer's unit, all of the patient's personal things were locked up, they couldn't touch them. They were only allowed to have a spoon to eat with. And it's like, why? They're still normal people. It took us a long time to get them to understand that, yes, they can have a butter knife. And yes, they can touch their personal belongings and things like that. It's like, it was really odd. You know, because if they were at home, they'd be touching their stuff and things like that. So, you know, some of the things that you can do is give them potatoes to peel, give them cloths to fold, things like that. Any kind of activity will help calm them down, okay? Like if somebody was a cook beforehand and now they have dementia, they can still cook. You can just have to supervise them and give them easier tasks to do. So you have to break it down. They can still do things like walking and dancing, things like that, gardening. I know over there we had a raised garden where we let them grow vegetables and stuff like that. Meal times need to be calm and free of distractions. foods need to be soft and bite-sized. Okay? Because sometimes they forget how to chew. Okay? Incontinence can be caused by a variety of things, but don't make them feel bad because they wet their pants or they pooped in their pants. Just quietly take them into the bathroom, clean them up, as if nothing happened. You do. Most of you, how many of you have ever trained somebody, a child to potty train? You don't want to make them feel bad about doing it because they're not going to do it, right? Same thing with an older adult. Let's respect them as an older adult who just had an accident. You know, take them in the bathroom, clean them up, move on. Okay? The other thing that you have to remember with Alzheimer's is it's very important that you check your attitude at the door. Okay? Because they can read your nonverbal as well as your verbal communication, okay? So, watch it very carefully, be nice. In here, we're gonna see dementia patients, and I'm telling you right now, as PDPM comes in, we're gonna see more of them, okay? We're gonna see more medical patients with problems than we do rehab. We're still going to have the rehab, but it's the whole dynamics of it is changing for payment. Okay? Any questions about what we've gone over today? Y'all are an awesome audience. Have a great day.